While healthcare can be thought of primarily in terms of financial transactions, it's important to remember that there are many ethical, legal, and regulatory factors that determine and constrain the financing and delivery of healthcare in ways that do not apply to other types of products and services. Right now, we'll be focusing on the broad ethical frameworks that are applicable to developing and using AI in the healthcare context. These include ethical frameworks that guide medicine, but also those that guide development and application of AI. First, all professionals are ethically bound and guided by professional ethics through codes and guidelines. These may not have the force of law behind them, but they do represent self-regulation that is the cornerstone of professional obligations and are critical to maintaining public trust. What do I mean by professional? I don't simply mean people who are paid for their services or people who have specialized expertise. By professional, I'm referring to those that may be paid for their work, but whose work serves a public interest. I'm including doctors, lawyers, and teachers as classic types of professionals. Professionals are entrusted with the well-being of people who seek their specialized expertise in times of need. Professionals have what is known as fiduciary responsibilities, meaning that they're expected to put the well-being of their clients ahead of their own interests or the interests of others. In return, professionals are given broad and special powers in order to do their jobs. In the case of physicians, they're allowed access to their patients' private health and financial information and are even allowed to do things that would be considered criminal in other contexts. However, the social contract that is implicit in the concept of professions allows such actions if they are necessary to serve the well-being of clients. For example, an anesthesiologist is allowed to render someone unconscious through the administration of drugs, and a surgeon is allowed to then insert a knife into that person. When people who are not physicians do these sorts of things to others, they're usually considered criminals. However, it is assumed that clinical professionals are acting overall in the best interest of their patients, even if at times it means that patients are subject to real harms. A key feature of professions is that they're given a lot of leeway to self-regulate. Medical professional associations set standards for and implement programs of licensure of clinicians to practice medicine. They assure a minimum level of competence and provide oversight over medical misconduct. That's not to say that a professional can't be sued or go to jail for acting unprofessionally. It means that professionals get to define what is good and bad practice and who is permitted to engage in such practices. As I alluded to before, professional associations also set their own codes of ethics. So I've said that professionals have fiduciary duties, meaning that they have ethical obligations to serve the best interests of their clients. It's important to note here that in order to serve the best interests of their patients, clinicians are extremely dependent on others to ensure that they are benefiting patients and not subjecting them to unnecessary harm. For example, clinicians have to rely on regulators and drug and device manufacturers to ensure that the diagnostics and treatments that they provide to patients are safe and effective. They have to rely on clinical researchers and scientists to provide valid evidence to support and guide clinical practices. The regulatory systems in place to evaluate drugs and devices and the certification systems to evaluate hospitals and laboratories are critical to maintaining the trust of both clinicians and patients. This becomes very important when thinking about how to develop artificial intelligence for healthcare applications, because these systems need to be trusted in order to be implemented successfully. In addition, it is important to recognize that while clinicians and healthcare organizations are trying to serve the best interests of their patients, they have interests of their own and are subjected to many competing or conflicting interests. More importantly, in the context of healthcare delivery, are financial interests. Understanding the interplay of these interests and how they are shaped by the structure of the health system is critical to understanding how AI models can be aligned or misaligned with these interests and affect patient care and well-being.